Alright, so we have a cyst that we're going to drain today. Okay, it's called a cyst of Mall. It's basically just a big sweat gland on the eyelid. Okay, patient here is, you can see the cyst right there. He's already numbed up. We put lidocaine, 5% lidocaine ointment on it. And so we're going to go ahead and get started. So there's many different types of eyelid cysts or lesions. Some can occur in oil glands, some in the accessory tear glands or sweat glands that line the eyelid. I think this is a clogged sweat gland on the eyelid. Now I say this because it's mostly translucent, and you can see that inside is mostly clear fluid and not oil that's set and hardened up over a long time. Now if you look closely here, you can see the fluid come out. You can see it right there, starting to come out after that first incision there. And these are the easiest and most successful kind to do, where it's not very viscous at all, so it's easier to get everything out. So we made our first incision, and then we can kind of drain it a little bit here. Use a little Q-tip. Put a little pressure on it, we get a little fluid out of there, and that thing is already like losing size, so that's good. So when I make an incision, at first I'll go in and put lidocaine usually on top of it to kind of get a little bit down into the incision, basically. Kind of numbs the inside a little better that way, because otherwise everything's kind of sitting on the surface. You okay still?
Yeah.
This is one of the easier ones you can do, really, to be honest with you, because it's all, apparently that thing's just been fluid all this time. I don't think there's much hardened up in there, so I think we're going to get most of it out. Fine, just keep looking right there. Kind of gets the underneath part here a little easier. Still feeling okay?
Mm-hmm. Oh, my bad.
That's okay. Kind of harder when you get your eye open, isn't it? That's okay, we're almost done with this part. You can go ahead and blink a little bit. Okay. So what I was doing there was just trying to get a different angle. I had him open his eye so I get underneath the cyst. Where he had his eye closed, I couldn't really get that extra pocket on the bottom. Sometimes these have multiple pockets, and you go in and you get one angle and you get you know, maybe the main big incision, big pocket. You get a lot of fluid out, but then there's a lot of other little ones deep in there, deeper than, and if you can get in and break those, you know, the walls of those, you'll get a whole lot more fluid coming out. Here I'm just cleaning them up, squeezing out a little bit more fluid after that first incision, trying to get all we can out of it, and then it's gonna make it easier for me to see what other little pockets are in there, how much more I really want to do. So he's doing really well at this point. And we've already made some good progress too. Half the size it was, what did you say? Or less? Okay. Let me take a look again here. I'm going to use my finger here on your lid just to kind of tighten it a little, tighten the skin. Yeah, I'm really trying to stretch out that lid here, and I'm really trying to see if there's anything else I can get to. I'm kind of poking at him, trying to see if there's any other kind of softer tissue, softer areas that I might be able to get through and get some more fluid. It's just a kind of a process of searching and trying to find how much you can do. And right there you see that I actually got a little blood coming out, but you know, it's almost impossible to do these without nicking at least a couple blood vessels. Down to the part of it that's kind of hardened up, really, that's been there for a while. But I'm going to try a couple more little places here, okay? Just getting different angles, trying to see if we can find another little pocket of fluid. Again, we're just trying a lot of different spots, trying to see if there's anything else we can get out for him. I think we're about done. Not really getting a whole lot more out of there. And he's probably getting tired of me poking at him. Okay, still?
Mm-hmm.
Yeah, that's kind of hardened up there. I think that might be about all we can do right now. Yeah, he's bleeding pretty good now, but at this point we are done. I've stopped poking at him and we're just cleaning him up a little bit. I think I've got all the fluid I can. I think I've gotten down to where there's actually a little bit of oil hardened up in there. Maybe not so much oil as just keratinized tissue or hardened tissue that's been there, because he's had this cyst for about 10 years now. Now again, this is not a clogged oil gland, okay? It's not what's called a meibomian gland. Now, those, when they get clogged, they can lead to a sty, what everyone calls styes. We call them hordeolum. But that can possibly get infected too and get really out of hand. Very uncomfortable. So we're just cleaning him up here at this point. So even though it is smaller, I expect it to be even smaller after you get this ointment I'm going to prescribe for you. And then put it on a couple times a day, Tobradex ointment. You're going to use it just right on there. You can get you a little 1/4 inch ribbon or so and just kind of rub it on this affected area here. The ointment is okay to get in your eye. It's actually, we prescribe it for other things too, and have people put it down inside their eye even sometimes, inside the lids. Okay, so then we apply a little bit of Tobradex ointment, which is what he'll get with his prescription at the pharmacy. It's got a little antibiotic in it, keep it from getting infected. It's got some steroid. The steroid will help with all the redness, the swelling, the puffiness. This will be a lot smaller after all the swelling goes down. It's already less than half the size of what it was when we started. Alright, let's film the final product. So here's what we had the day of, after we took everything away and we were getting ready to let him walk out. It was still a little swollen. You can see it's a little red there where we nicked some of the blood vessels, bruised just a little bit, but that's okay. That'll reabsorb. There's the initial picture of what it looked like. Of course it has lidocaine gel on it there. Here's one after a few days, what it looked like. Still red, still a little puffy. And then here's after about a week. And you can see it looks tremendously better at this point. And very good, very successful outcome. And that's what you want. Alright, so I hope this was interesting to you. Thank you guys for watching. Have an amazing day, and I'll see you in the next video.